Welcome to Module 3. Here we will be discussing IPC in the context of COVID-19. The learning objectives for this module are that you should be able to describe IPC standard precautions and additional transmission-based precautions that are generally recommended in healthcare facilities, and then describe source control, administrative controls, and environmental and engineering controls. You should be able to describe the WHO recommended IPC measures for healthcare facilities. First, I will outline the IPC technical guidance documents that have been developed for COVID-19. There have been several IPC technical guidance documents posted on our website since the beginning of the outbreak. The main document, IPC during healthcare when COVID-19 is suspected, outlines the IPC measures that should be in place when caring for a suspect or confirmed case of COVID-19. The rational use of PPE and considerations during PPE shortages is a document that outlines what facilities should do to prepare for a shortage of stock supply, such as masks, as we've currently experienced in this outbreak. Next, there is an advice piece on the use of masks in the community, during home care, and in healthcare settings. WHO regularly monitors all emerging evidence about these critical topics and will provide updates as more information becomes available. The IPC during healthcare when COVID-19 is suspected is the main IPC technical guidance document. It outlines WHO advice for COVID-19 for healthcare workers in healthcare facilities and in other settings, as well as for the general community. The main recommendations are the following. First, we encourage physical distancing, which means you should avoid close contact with people suffering from acute respiratory infections. These are people that are coughing, sneezing, and are clearly unwell. Next, we recommend frequent hand hygiene, especially after direct contact with sick people or their environments. Also, for people with symptoms of acute respiratory infection, we recommend they practice respiratory etiquette, they wear a medical mask, and they seek medical care if in respiratory distress. Physical distancing, also known as social distancing, is one of the key measures of infection control and key recommendations that you have heard about during this outbreak. It refers to keeping a physical distance of at least 1 meter from others, as well as ensuring healthcare facilities are designed in such a way that ensures patients are seated away from each other in waiting areas, and that patient beds and other activities are at minimum 1 meter apart. For group settings such as in cafeterias in the healthcare facilities, we recommend workers do not sit next to each other or share meals or other items. We also recommend staff visitors and others to avoid unnecessary touching or close contact. The rational use of PPE document was updated in April to include strategies to optimize the availability of PPE. There is a link at the bottom of the slide where you can access this document for more details. The document also includes considerations for the extended use of PPE for those facing PPE critical shortages. Reprocessing is not advised for surgical masks or respirators. However, there have been some processes for which respirators have been reprocessed successfully through vapor of hydrogen peroxide and UV disinfection. Keeping in mind each of these measures carries significant risks and limitations, they should only be considered as a last resort when all other strategies for rational and appropriate use and procurement of PPE have been exhausted. This slide outlines the strategies to minimize the need for PPE. These include considering telemedicine to evaluate suspect cases, minimizing the need for them to visit healthcare facilities for evaluation in person. Implementing physical barriers such as glass or plastic windows where patients may first present, such as in triage areas or the emergency registration desk or a pharmacy window. Limit the number of healthcare workers entering COVID-19 patient rooms, and plan ahead what activities will be performed at the bedside to avoid multiple entries and exits. Consider bundling activities, and do not allow visitors where COVID-19 patients are isolated or restrict their number and time allowed spent there. The advice on the use of masks for COVID-19 was recently updated on the 5th of June. This document provides advice on the use of masks in various settings such as healthcare, home care, and in the community. It is intended for decision makers, public health and infection prevention and control professionals, as well as healthcare workers and individuals in the community. The updated information on transmission from symptomatic, pre-symptomatic, and asymptomatic people infected with COVID-19 was the basis for this new guidance. It includes information on what type of mask to wear in different settings and by various populations, as well as new research on non-medical masks with regards to the ideal types of fabrics, number of layers, composition, and the shape of homemade fabric masks. WHO overall guidance for decision makers remains the same. WHO advises decision makers to apply a risk-based approach for advising on mask use in the community. More information can be found at the bottom of this slide in the link. Masks are part of a comprehensive package of measures to suppress transmission and save lives. The use of a mask alone is insufficient to provide an adequate level of protection. The package of measures includes that people with symptoms suggestive of COVID-19 should stay at home and call their healthcare provider. Suspect cases should be tested for COVID-19. Confirmed cases should be isolated, and contacts of those confirmed cases should be quarantined for 14 days. Everyone should avoid touching their face, and if they wear the mask, the front of the mask. Everyone is encouraged to clean their hands frequently and thoroughly and keep a distance of at least 1 meter from others. The community should be informed about the disease and engaged in these measures. What hasn't changed from previous guidance is that the recommendations for healthcare workers when caring for a COVID-19 suspect or confirmed case remain the same. The recommendations are for contact and droplet precautions. That means medical masks, gown, gloves, and eye protection to be used when caring for a suspect or confirmed COVID-19 patient. For aerosol-generating procedures and/or settings, the use of respirators is encouraged. The guidance was updated to incorporate new research findings and to provide more practical advice to decision makers. The main changes relate to the use of masks by health workers and specifics on non-medical masks for the general public in areas of community transmission. This means that we recommend health workers to continuously wear masks throughout their shifts in clinical areas. For the general public, we recommend they only wear masks in communities where widespread transmission of COVID-19 exists and physical distancing cannot be maintained. The new guidance also outlines the ideal features of a fabric mask. Medical masks are meant to provide both a protective barrier from others and source control from the wearer. Thus, they are encouraged for health workers or anyone taking care of a sick person, for anyone with symptoms suggestive of COVID-19, and for those vulnerable populations, which includes those aged 60 and above, and those with underlying health conditions. Non-medical masks or fabric masks are intended as source control, and thus are meant to protect those around the mask wearer. They are intended for people in the general public in settings where at least 1 meter distance cannot be maintained. This includes public settings such as workplaces, buses, metros, shopping stores, etc. It also includes essential workers who may be in close contact with the general public during their work. Slide 13 outlines examples of where the use of a medical and non-medical mask should be considered for the general public. For example, in areas where there is intense community transmission and there is limited or no capacity to implement the other containment measures such as physical distancing, contact tracing, appropriate testing and isolation, and care for suspected or confirmed cases. The general public is advised to wear a non-medical mask in places like grocery stores, at work, social gatherings, mass gatherings, schools, etc. The purpose of this would be for source control. So if they were infected and did not yet know it, they would be protecting those around them by wearing a mask. Another setting that encourages the use of a non-medical mask is in those that have high population density where physical distancing cannot be achieved, and all of the other containment measures are also limited. This includes people living in cramped conditions and specific settings such as refugee camps, camp-like settings, or slums. Again, the purpose of this is for source control. Please take a minute and go through these examples in more detail. Another example of where you should wear a non-medical mask is in those settings where a physical distance of at least 1 meter cannot be achieved. This includes public transportation such as buses, metros, trains, or a plane. Also, for specific working conditions where the employee is in close contact or potential close contact with others, such as social workers, cashiers, or servers. Again, the purpose of this is for source control. The new research findings outlined in the document outline the type of materials that should be chosen when making your own fabric mask, keeping in mind the filtration efficiency and breathability of the layers of materials. The number of layers should be a minimum of 2, but ideally 3. There should be a combination of material or fabric used. Choose water-absorbing or hydrophilic materials or fabrics for the internal layers to readily absorb droplets. Combine with an external synthetic material that does not easily absorb liquid, also known as hydrophobic, for the outer layer. The inside layer should ideally be a filter. More material examples are outlined in the document. It also outlines the mask shape, the coating of fabric, and mask maintenance. Keeping in mind, masks should only be used by one person. They should be changed if soiled or wet, and non-medical masks should be washed frequently and handled carefully so as not to contaminate other items. They should ideally be kept in a plastic, resealable bag. Clothing fabrics used to make masks should be checked for the highest permitted washing temperature, which is indicated on the clothing label. Non-woven polypropylene spunbond may be washed at high temperatures up to 140 degrees Celsius, and the combination of non-woven spunbound and cotton can tolerate high temperatures, so masks made of these combinations may be steamed or boiled, ideally every day after a day of use. The document also outlines how to wear a mask properly. First, ensure hand hygiene is performed before touching the mask. Place the mask carefully on your face, ensuring it covers the mouth, nose, and chin, and tie it securely to minimize any gaps between the face and the mask. Avoid touching the mask while wearing it. Replace it as soon as it becomes damp, and remove the mask with the appropriate technique. Washing your hands before touching the mask. Do not touch the front of the mask, but untie it from behind the head or the ears. After removal, and whenever a mask is used, clean your hands using an alcohol-based hand rub solution, or if hands are visibly dirty. For a demonstration on how to properly wear and remove a mask, please visit our website, as there have now been some updated videos. So what IPC strategies are recommended by WHO for COVID-19? The IPC strategies to prevent or limit transmission in healthcare settings include the following: applying standard precautions for all patients, ensuring triage and early recognition and source control, as well as implementing empiric additional precautions for suspected cases of COVID-19. These are droplet and contact precautions. In addition, implementing administrative controls and using environmental and engineering controls. So recommendation number 1, applying standard precautions for all patients. This is the basic level of IPC precautions to be used for all patients at all times, not just in times of outbreak. The minimum prevention measures that apply at all times to all patients, regardless of suspected or confirmed status of the patient. This risk assessment that should be performed by healthcare workers is critical for all activities. This means assessing each healthcare activity and determining the personal protective equipment that is needed for adequate protection, regardless of their isolation status. The elements of standard precautions are hand hygiene, respiratory etiquette, PPE according to your risk assessment, safe injection practices, sharps management and injury prevention, as well as safe handling, cleaning, and disinfection of patient care equipment. This also includes environmental cleaning and safe handling and cleaning of soiled linen, as well as waste management. This diagram represents the chain of transmission. An infection occurs when a microorganism enters the body and increases in number and damages tissues in the body. For any infection to spread, all steps in the chain must occur. The key to stopping the spread of infection is to break at least one link within the chain. So hand hygiene. We have evidence to prove that this is the best way to prevent the spread of germs in the healthcare setting and in the community at large. We know that our hands are our main tool for work as healthcare workers, and they are the key link in the chain of transmission. Think about this when you are going to touch door handles, touching medication, touching your phone, instruments, and touching patients and their environment. WHO promotes the 5 moments of hand hygiene. Moment number 1 is before you're entering the patient's environment and touching a patient, you should be doing hand hygiene. This involves either alcohol-based hand rub or water and soap. Before preparing a clean or aseptic procedure, you should be practicing hand hygiene again. And after bodily fluid exposure or risk, you should be practicing hand hygiene. This means if you have soiled gloves or soiled hands, you should be taking them off and practicing hand hygiene with water and soap. After touching a patient, you should also be performing hand hygiene. And after leaving the patient's environment or surroundings, you should again be performing hand hygiene. This means that after taking off your PPE, you should be performing hand hygiene as the last step. There are many posters available on the WHO website on how to hand rub using alcohol-based hand rub or how to hand wash using water and soap. Please make note to use the appropriate product and the technique. So we know that alcohol-based hand rub is preferable if the hands are not visibly soiled. We recommend rubbing the hands for 20 to 30 seconds with this. However, if your hands are soiled, we recommend water and soap and a single-use towel when visibly dirty or contaminated with material. We recommend washing with water and soap for 40 to 60 seconds. These are some alternative posters that show how to perform hand rub or how to hand wash. The second element I had mentioned earlier was respiratory hygiene. Why is respiratory hygiene or cough etiquette so important in times of outbreaks such as the one for COVID or any other respiratory outbreak? Good respiratory hygiene or cough etiquette can significantly reduce the spread of microorganisms or germs that cause respiratory infections like the cold, flu, or COVID. This includes turning your head away from others when coughing or sneezing, covering the nose and mouth with a tissue and discarding that tissue immediately, or coughing or sneezing into your elbow if no tissue is available. And then we recommend hand hygiene, cleaning your hands with soap and water or alcohol-based products. So, how to promote respiratory hygiene in a healthcare facility? This is where healthcare workers should be encouraging hand washing for patients with respiratory symptoms, providing them with masks if they are to leave the room, and these patients should be kept away from other patients in their own single room or at least 1 meter away with a mask on. There should be visual aids such as posters all around the healthcare facility for patients and visitors with respiratory symptoms to cover their cough and practice respiratory etiquette, as we previously mentioned, and hand hygiene. so please consider having masks and tissues available for patients in all areas. These are some of the PPE or personal protective equipment items that are for use in healthcare settings. The first is a gown, which should be used to protect the body and the clothing of the healthcare worker. The medical mask covers the nose and mouth and acts as protection for the healthcare worker. An alternative to this is the respirator, also known as N95, FFP2, or FFP3. This is used when airborne precautions are recommended. The eye protection consists either a face shield or goggles. These are usually used in combination with a mask or respirator. The gloves should be used to protect the hands and prevent transmission of infectious material during healthcare. Remember to combine these with hand hygiene at all times. So we talked earlier about the risk assessment and standard precautions. Risk assessments mean that the risk of exposure and extent of contact that you anticipate with blood, body fluids, respiratory droplets, or open skin. Once this is done, you should select which PPE items to wear based on this assessment. You should be performing hand hygiene according to the WHO 5 moments for hand hygiene, and this should be done for each patient, each time you encounter them. So think about building this into your routine. As you're walking towards a patient's room, you should automatically be thinking, what does the patient have and how can I protect myself? Here we show some scenarios of when you should wear the various kinds of PPE. I won't go through them all, but please take some time to look at this chart. So some of the principles for using PPE. Always clean your hands before and after the wearing of the PPE. PPE should be available by the healthcare facility when and where it is indicated. So this should be outside patient care rooms and inside if you anticipate needing PPE for some sort of activities. They should be provided in the correct size, and you should be selecting these according to risk or per the precautions noted for the patient. They should always be put on before contact with the patient and their environment. They should always be immediately removed after completing the task and leaving the patient care area. PPE should never be reused. However, if you have some sort of reusable PPEs, these should be cleaned and disinfected after every use. PPE should be immediately changed if it becomes contaminated or damaged. PPE should not be adjusted or touched during patient care. Specifically, make sure to never touch your face while wearing PPE. If there is concern or breach of these practices, leave the patient care area when it's safe to do so and remove and change your PPE. And always keep in mind to remove carefully as to avoid self-contamination. Standard precautions also includes the steps to safe injections. So this means you should always have a clean workspace, perform hand hygiene, perform medication preparation with sterile, safety-engineered syringes, sterile vial of medications. You should perform skin cleaning and antisepsis, an appropriate collection of sharps, and appropriate waste management. So what is decontamination? This is the process that removes soil and pathogenic organisms from objects so that they are safe to handle, safe to process, safe to use, and to discard. Cleaning refers to the first step required to physically remove contamination by foreign material. It will also remove organic material such as blood, secretions, excretions, and microorganisms to prepare a medical device for disinfection or sterilization. Disinfecting refers to the process to reduce the number of viable microorganisms to a less harmful level. This process may not inactivate bacterial spores, prions, and some viruses, and thus sterilization is needed. Sterilization is a validated process used to render an object free from viable microorganisms, as mentioned above. These include viruses, bacterial spores, but not prions. What are some of the principles of cleaning? Cleaning is the physical removal of foreign material and organic material. It physically removes rather than kills microorganisms. It is accomplished with water, detergents, and mechanical action. The basic principles of cleaning and disinfecting apply to all patient care areas. So be sure to always clean the patient care equipment between each use. And where possible, dedicate cleaning supplies in higher risk areas. These are isolation rooms, delivery rooms, and operating rooms, among others. The cleaning supplies for isolation should be kept and only used in the isolation rooms. When cleaning, always move from the cleanest area to the dirtiest area, and clean from high to low areas, outer to inner. Clean the isolation areas last with their own dedicated equipment. Damp dusting and wet mopping is recommended to minimize dust. And you should be using a 3-bucket system for cleaning and disinfection. The water you should be using should be clean water, and the spraying of disinfectants is not recommended. For isolation rooms, you should be increasing the frequency of cleaning by housekeeping in patient care areas. Isolation rooms should have their own cleaning supplies that are separate from clean patient care areas. And all waste from isolation rooms should be considered contaminated and should be disposed following your facility's method for contaminated waste. Cleaners or housekeeping should ensure that they are wearing the appropriate PPE when cleaning an isolation room or area. These are the recommended cleaning procedures and frequencies, although I won't go through all of them. So routine cleaning, as we mentioned, applies to all rooms. So this is when the room is occupied and you're just there to remove the organic material and minimize microbial contamination, and to provide a visually clean environment with an emphasis on surfaces within the patient zone. Terminal cleaning is cleaning and disinfection after the patient is discharged or transferred from the room. This includes the removal of organic material and significant reduction and elimination of microbial contamination to ensure there is no transfer of microorganisms to the next patient who will occupy that room. So how to manage used linen on the wards? We recommend you wear PPE according to the risk when handling used or soiled linen if appropriate. You should be handling soiled linen with minimum agitation to avoid contamination to the environment. Place the soiled linen into bags at point of care. If the linen is grossly soiled, we recommend remove the gross soil with a gloved hand and using a flat, firm object. Discard the solid material into the toilet and dispose of towels into the waste. Place the soiled linen into a clearly labeled leak-proof container in the patient care area before transport. Linen should be sorted and transported in a way to prevent contamination. And clean linen on the patient care wards should be stored in a designated area, for example, a closed room or a closet, or closed containers away from public access. The waste management process should be as such, and safe treatment of waste generated during healthcare activities is the responsibility of all staff. Some additional considerations for standard precautions is that it is important to ensure the environmental cleaning and disinfection procedures are followed consistently and correctly by all staff. Thorough cleaning environmental surfaces with water and detergent and applying commonly used hospital-level disinfectants are effective and sufficient procedures. Medical devices and equipment, laundry, and food service, utensils, and medical waste should be managed in accordance with safe routine procedures. There is now a cleaning and disinfection guidance document where you can find information on what disinfectant solutions are most appropriate for COVID-19 and the recommended ingredients and modes of preparation for these. Please note that spraying or fogging of people is strongly discouraged and could be harmful to their health. According to recent studies, SARS-CoV-2 has been shown to survive on various surfaces anywhere from a few minutes to hours. This reinforces the recommendation that surfaces, especially high-touch ones such as door handles, bed rails, tables, trays, and bathrooms, should be thoroughly cleaned and disinfected. You can see on the table the various types of surface materials and the length of time that has been shown to have COVID virus on them. Keeping in mind these may not be infectious virus particles. The guidance also outlines recommendations for how often certain patient care areas should be cleaned and the correct PPE to wear when doing so. Please take a moment to read through this slide. So now we move on to recommendation 2, ensuring triage, early recognition, and source control. Clinical triage is to be used in the healthcare facility for the early identification of patients with acute respiratory infection to prevent the transmission of pathogens to healthcare workers or other patients. Screening areas should be set up to ensure adequate space for triage, maintaining at least 1 meter distance between the staff who are doing the screening and the patients or staff entering. You should have hand hygiene alcohol rub and masks available, as well as medical gloves, eye protection, and gowns to be used according to the risk assessment. There should be waiting room chairs distanced at least 1 meter apart for those who are waiting. A one-way flow of patients and staff should be maintained throughout the center, and clear signage for symptoms and directions should be posted for patients. Family members and visitors should be encouraged to wait outside the triage area to prevent overcrowding. Triage or screening areas require the following equipment: a screening questionnaire, an algorithm for triage to let the healthcare worker know what to do once the patient has answered yes to any of the questions, documentation to ensure that there is clear communication among healthcare workers what questions have been answered positively or negatively and what requirements the patient needs, PPE available for the healthcare worker and the patients, and this includes hand hygiene equipment and posters to be posted around the room, infrared thermometers if they are available to test for fever, waste bins, and access to cleaning and disinfection solutions. As well, we recommend signage in public areas with syndromic screening questions to instruct patients to alert healthcare workers if they do have any symptoms. For the hospital admission and triage and the flow of the patients, we really recommend in these situations where there will be a high flow of patients into the emergency room with respiratory symptoms, we recommend avoid admitting low-risk patients who don't have respiratory symptoms and don't have any underlying diseases. We recommend cohorting patients if they have the same diagnosis, but we don't recommend placing suspect patients with confirmed patients. So the cohorting piece really has to be thought out, and it has to be engaging the infection prevention and control team in the healthcare facility to ensure that the correct decisions are made. We recommend also placing these patients with symptoms in a single well-ventilated room as soon as possible and when possible. And if that's not possible, to place the measures that I previously mentioned. And to assign healthcare workers experience in outbreaks and practice good infection prevention and control measures. So now we move on to recommendation number 3. This is where we recommend the additional precautions for suspect and later confirmed cases of COVID-19. So additional precautions are for patients who are symptomatic and are suspect cases, or they have a confirmed infection with a highly transmissible pathogen, in this case, COVID-19. So when the pathogen is considered important from an epidemiological point of view, we recommend additional precautions. When medical interventions increase the risk of transmission of a specific infectious agent, such as aerosolizing procedures, we recommend airborne precautions only when doing aerosol-producing interventions. And when the clinical situation prevents the systematic application of standard precautions, we recommend additional precautions to ensure that the healthcare workers are protected and that other patients and others in the healthcare facility are also protected. So what do additional precautions include? Well, they include the standard precautions that we've mentioned previously and the special accommodations and isolations that come with additional precautions. So these are the single rooms or the space between the beds, which we've mentioned, having a dedicated toilet, and they recommend signage outside of the patient's room or bed to ensure that all healthcare workers going to see that patient are aware the patient is on isolation. They include the PPE, so the PPE that is recommended for contact and droplet precautions, and we will go through it later, and dedicated equipment and cleaning of this equipment between patients and really between patient uses. We also recommend limiting the transport of these patients, and if it must be done for tests, they are recommended to also wear a mask. And of course, as always, we recommend good communication between all healthcare workers and staff caring for the patient. So what is different about transmission-based precautions and standard precautions? Well, transmission-based precautions really include standard precautions and the additional measures that I mentioned. Standard precautions are part of the transmission precautions because we must always remember to maintain the basics that we've previously mentioned, such as hand hygiene. So the types of additional precautions that are based on modes of transmission. There are direct modes, such as direct contact. This occurs through touching, and an individual may transmit organisms to others by skin-to-skin contact or contact with the surfaces in the healthcare facility. Droplet spread refers to the sprays that are relatively large, but they are short range, which means they don't go past 2 meters, and they are usually produced by sneezing or coughing. And then there are the indirect modes. There's indirect contact, which refers to the transfer of an infectious agent from a reservoir to a host through things like airborne transmission, where infectious agents are carried by dust or droplet nuclei suspended in the air. Or there are vehicles that may indirectly transmit an infectious agent, such as patient equipment or surfaces in the environment. Or there are vectors, such as mosquitoes, like we know for other infections, that may carry an infectious agent or may support growth or changes in the agent before it reaches the human host. So coming back to COVID-19, patients who are suspected or confirmed are recommended to be on contact and droplet precautions for all patients with suspected or confirmed COVID-19. Airborne precautions are only recommended for aerosol-generating procedures. So these are things like suctioning of the respiratory tract, intubation, bronchoscopy, or resuscitation, and others. So all patients with respiratory illness should be in a single room, or if possible, should be at least 1 meter away from other patients in a waiting room. And as we've previously mentioned, we do recommend that a team of healthcare workers are dedicated to care exclusively for suspected patients. We recommend these healthcare workers to wear the appropriate PPE at all times when caring for these patients. And of course, not to forget the hand hygiene that should be done any time that the WHO 5 moments of hand hygiene apply, and to keep in mind that this is also before and after removing PPE. As well, equipment should be single-use when possible. If not possible, it should be disinfected between uses. We avoid the transportation of suspected or confirmed cases and have these patients wear masks, and the healthcare workers to wear the appropriate PPE. We recommend routine cleaning of the environment as well as additional cleaning for these rooms. And we recommend limiting the number of healthcare workers, visitors, and family members who are in contact with the patient. And if necessary, everyone must wear PPE when entering the room. We also recommend that visitors or others who are not healthcare workers staff who are dedicated to the patient should be recorded, let's say on a sign-in sheet outside of the patient's room for contact tracing purposes. Precautions should continue until the patient is asymptomatic and the healthcare team deems them no longer infectious. So moving on to the specific types of precautions. Contact precautions ensures that patients are in a single room and that they are to stay in that room. It recommends that hand hygiene is done according to the 5 moments, and in particular before and after removing PPE. We recommend also avoiding touching your face, eyes, nose, or mouth with contaminated gloves or ungloved hands. We recommend that staff always wear the appropriate PPE, and in this case would be gown and gloves, and the appropriate equipment cleaning, disinfection, and sterilization is performed. And as I've mentioned earlier, we recommend regular and enhanced environmental cleaning of this patient area. And of course, to keep in mind to avoid contaminating surfaces that are not involved with direct patient care. The second precautions we recommend is droplet precautions. So again, they should be in a single room or separated by at least 1 meter, and healthcare workers must wear the appropriate PPE. In this case, in addition to what we've mentioned in contact, droplet also ensures that the face is covered. So this requires a medical mask, eye protection, whether that's goggles or a face shield, and a gown. And again, the patient is to stay in the room and not have any movement outside in the inpatient units or in the hospital environment unless they are needed to be transported to a test. And in that case, we again recommend the patient wears a mask and the healthcare workers wear the appropriate PPE. So airborne precautions, as I've mentioned, are only being recommended for aerosol generating procedures. These are things like bronchoscopy, intubation, resuscitations, and others. For airborne, we also recommend the single room, usually with negative pressure, or if that's not possible, to at least have adequate ventilation. So this is natural ventilation with airflows of at least 160 liters per patient, or in a negative pressure room with at least 12 air exchanges per hour and in a controlled direction of airflow when using mechanical ventilation. So the PPE in total should be the contact droplet, and in cases of aerosol producing interventions, you should add airborne to that. And for airborne, it requires the N95 masks or the FFP2s or equivalent masks, only for airborne. There are instructions on how to do a proper mask fitting for N95 masks, and these are usually done with the occupational health department in your healthcare facility so that you know what size would best fit you. And every time you put the N95 on your face, you should be required to do a seal check. So this ensures that there is no leakage. And if there is any leakage, that you should be adjusting the position and the straps and retesting the seal. You should ensure every time you go into the room to perform an intervention that these respirators are sealed properly. So here's the poster for COVID precautions for contact and droplet precautions. It also has an option for the respirator when you're performing an aerosol generating procedure. This poster is available for download on the same OpenWHO website where you found this video. So how to put on PPE. So you can look at these images and go through the steps, and these should also be outlined in the precaution signage outside of the patient's room. So the first step refers to the risk assessment you should be doing when you are entering the patient's room or the area. So what situation are you walking into? What symptoms does the patient have? And what precautions are they on? What PPE will you need for these precautions? Gather this and prepare to walk into the patient's room when you are done putting on your PPE. The first step is to perform hand hygiene. So this is either with an alcohol-based hand rub, and you should be doing this for 20 to 30 seconds, or with water and soap, and we recommend 40 to 60 seconds. Next, you would be putting on the gown. And next, you put on the mask. So this is a medical or surgical mask for droplet precautions. Or if you are going into an airborne precautions room to perform an intervention, you should be putting on the N95 mask and doing the seal check. For the eye protection, you should be putting on goggles or a face shield. And lastly, you should be putting on your gloves. So the order that you're putting on the PPE is not as important as the order when you take off the PPE. So you've gone in the room, you've performed the healthcare activities you needed to do, and now you're coming out of the room and you need to take off the PPE before you go anywhere else in the healthcare environment. So the order for this is very important because you have to try to not contaminate yourself with any material that has been on the PPE during your transactions in the room. So you have to remove the areas that are most dirty first. So this would be your gloves. And you have to do this in a way where you are not self-contaminating your clean hand with the other glove once you've taken them off. So there is a process on how to take off the gloves safely and efficiently. Next, you remove your gown. This is the next biggest dirty piece that may have been soiled during your time in the room, and this should be taken off before you do anything else. Next, we recommend hand hygiene before you touch your face. So now that you've taken off the gloves and the gown, your hands still may be contaminated. So again, this is hand hygiene that you should be doing with an alcohol-based hand rub, or if not available, with water and soap. So now you're ready to touch your face. So you should be removing your eye protection, so this is your goggles or your face shield, and your mask. And the way to do this is to be very careful to not touch the mask or the goggles, because they also may have been dirty when you were in the room. And so you are supposed to be removing the mask by just removing the straps from around your head. So next, now that you're done removing all the PPE, the last step and final step, and the most important step, is that you now have to do hand hygiene again to ensure that there's nothing left on your hands before you move on to the next patient or anywhere else in the healthcare facility. In addition to the precautions mentioned before, we also recommend that administrative controls are put into place. These include things like adequate training for healthcare workers on infection control, ensuring adequate patient-to-staff ratios, establishing a surveillance process among healthcare workers who may be infected, ensuring that healthcare workers and the public understand the importance of promptly seeking medical care if they are symptomatic, and monitoring healthcare worker compliance with standard and additional precautions, and providing the mechanisms for improvements as they're identified. So that is it for PPE. So now we move on to other areas of a healthcare facility, such as outpatient care. So the principles of IPC and standard precautions should apply to all healthcare facilities, whether they are primary, secondary, or tertiary care. So for COVID-19, we recommend the following measures for outpatient care. Again, the triage and early recognition is crucial to ensure that these patients are not sitting symptomatic in a waiting area. We recommend the same syndromic screening to be done in clinics. So this is going through the questions about fever, respiratory symptoms, and travel-related history or contact with others. And we place a heavy emphasis on hand hygiene and respiratory hygiene and etiquette. So there should be hand hygiene, alcohol rub, and medical masks available to patients in case they are symptomatic and they are waiting in the waiting area with other patients. And as always, we recommend to place the patients in a single room as soon as possible if they are symptomatic. If this is not possible, we recommend they wait in the waiting area, hopefully off to the side, or you have a separate waiting area, or at least being separated by minimum 1 meter from other patients in the waiting area. And we recommend you prioritize the care of symptomatic patients so as to limit their time in the waiting room. We recommend also education for patients and their families about the early recognition of symptoms, basic precautions to be used both out in the community and at home, and which healthcare facility or hotline they should refer to if their symptoms worsen. So moving into home care. We know most of the COVID patients will have mild symptoms and thus are recommended to be cared for at home or to self-isolate at home. So what IPC strategies do we recommend for COVID-19 in the home? Well, there's a technical guidance document that has been produced and is available on our website, and you can visit it for more detailed information. I will go through some of the quick facts with you. So patients with mild respiratory symptoms, like I mentioned, should be staying at home and self-isolating until they are recovered. So WHO recommends that the patient has ongoing communication with a healthcare provider or public health link person during the full duration of their home care period until the resolution of symptoms. So if the healthcare workers are visiting patients within the home, we recommend the same precautions: to wear a mask and perform the appropriate hand hygiene when providing care, to educate the patient on how to limit exposure to the rest of their family, and to teach them respiratory etiquette and hand hygiene. So again, to cover their mouth and nose when sneezing or coughing, either with their elbow or with a tissue, and then performing hand hygiene. This would limit the spread even within their home. And we recommend that they educate caregivers within the home on how to appropriately and safely care for the ill member of the family, and to provide the patient and the family with ongoing support, education, and monitoring. So the caregivers, who are usually the family members, if possible, should be, as I mentioned, educated on the type of care they're supposed to be providing and the available protection that they have to ensure that they don't also get infected. And if they're not providing care, to ensure that they just keep a healthy, safe separation from the ill member of the family just until the symptoms improve. And to remind the patient, if possible, to practice hand hygiene as much as possible, respiratory etiquette, or to wear a mask if they're going to be in the presence of other family members who may be at risk. And that brings us to the end of Module 3. These are the resources that are available on our website, and there are many more that are related to IPC and other areas of COVID-19 case management. So please go to the WHO website and you will find all of the technical guidance documents that we've produced. There's also FAQs there, hopefully answer some of your questions that you may have. And if not, please email us and get in touch with any of the questions that you may have. Thank you to everyone who contributed to this online education, and we look forward to hearing your feedback. Thank you.